Welcome to our weekly show for the National Association of Independent Medical Practices. You can find us at NAIMP.org. NAIMP is an organization focused on helping independent medical practices become more successful by providing innovative discussions, networking with like-minded professionals, and opportunities for growth, education, and increased revenue. Check out our website today at naimp.org.
Hello, this is Shirley Crest-Dudley, and welcome to today's show. I'm delighted to introduce our guest speaker for today, Beth Boynton. Beth is a nurse consultant specializing in communication and collaboration. She has recently completed her second book, coming out this spring, called Successful Nurse Communication: Safe Care, Healthy Workplaces, and Rewarding Careers. Beth writes about related issues at her blog, Confident Voices in Healthcare, and has a video, Interruption Awareness, a Nursing Minute for Patient Safety, that draws audiences from all over the world. She's excited about using theater improv activities to help teach these skills in an effort to make healthcare safer and more rewarding to work in. Beth is trained in the Professor Watson curriculum for medical improv through Northwestern University Feinberg School of Medicine. She has one grown son who works in India, and she loves improv, Zumba dancing, walking, swimming, and lives in Portsmouth, New Hampshire. So Beth, I'm going to turn it over to you for medical improv, an out-of-the-box solution for the people skills we need.
Thank you so much, Shirley. I am excited to be talking with the NAIMP membership and anyone else who's listening in. I'm very excited about the concept of medical improv, and I suspect that there'll be some entrepreneurial spirits among you that will get jazzed about it too. So let me start out with an outline for our talk this morning. I'll share a couple of objectives with you and a vision for what you might expect from engaging in some medical improv in your practice. We'll talk about what people skills are, and then I'll get into a little bit more of an evidence-based piece. We'll study some statistics from the Joint Commission, specifically the subcategories of root causes of sentinel events and how they're related to people skills. And then I will introduce you to medical improv itself with a definition, give you an overview about what it's all about, and then we'll again go into some more detail about the principles. There are 7 key principles of medical improv, and once you know those principles, you can do a whole bunch of different activities that build different people skills, and we'll talk about that too, and then I'll wrap up with some other ideas. So I hope that sounds interesting. I'll do my best to keep it interesting. So here are our 2 objectives. The first one is to raise awareness about the importance of people skills in healthcare. And the second one is to introduce this concept of medical improv as an out-of-the-box process that builds the people skills. And I think you'll find that it does a lot more besides that. So what are people skills? As an organizational development consultant, we often refer to what are called soft skills. And I think even though they're really hard to build, they're called soft skills because they're the more gray, wishy-washy, human, touchy-feely stuff that we don't always know what to do with in an evidence-based medical model. Other terms that you might hear would be social and emotional learning, or social skills, interpersonal dynamics, that kind of stuff. And it incorporates, those of you that are listening on the slide, I'll read some of the links, but you may want to go back to the NAIMP website to see the slides where there's a little bit more detail than I might say in the audio version. But anyway, some of those skills would include respect for self and respect for others, perspective taking, can you see a different point of view, and can you see a different point of view when you're in conflict, critical thinking, there's the ability to identify social cues, building trust, having forgiveness, Are you able to be a leader, and are you able to be a follower? And in reality, we need to be able to do both. Can you manage your feelings? Do you know where they're coming from? And those kinds of things. And you know what? I'm going to go back one slide because I kind of skipped over the Imagine in your office slide. But I think that's okay because it's improv and it's not perfect, but we generate a little bit of it as we go along. So now that you know what people skills are, let's imagine for a minute what that would look like in your office. Everybody's getting along. Imagine that. And the care that you're providing is safe and compassionate. That's just the standard operating procedure. Patients can't seem to stop talking about how kind and how helpful everybody is. And staff seem to be happy about their work. At times they're having fun, even amidst some of the stressful and maybe not fun experience that we share. There is still this element of joy about work. And conflict is productive. People that are coming to your office with concerns or problems, they're bringing with them constructive ideas for change. So it's not just about he said, she said, alignments, and I want you to be on my side and do this and do that. It's more about how can we work together to solve a problem. And what's more, you'll find that your bottom line is improving, and that's because the interpersonal dynamics that are at work are more positive than counterproductive, and as such, they're not contributing to wasted resources and workers' comp issues and additional stress or staff turnover. So that gives you kind of an idea of what might happen with your staff and the dynamics in your office with some medical improv under their belt. So now let me move forward here. We talked about what people skills are and how are people skills involved in healthcare. And through my lens, I see them as either having a positive or a negative role in everything. And I always encourage people to challenge me on that one. If you have an issue that you don't think there are underlying roots of people skills, please let me know, and I'll love to have a discussion about it. But we see them in work-related injuries, workplace violence. I mean, really, it's like if you have positive people skills, then you have respectful interprofessional interactions. And if you don't have good people skills, then there is a more likelihood of workplace violence. If you have positive people skills, then people are engaged and they're contributing to managing change and having the change be productive and meaningful and useful. If they're not, then we end up in these issues where there's alignments and resentments and resistance to change, and it affects everything. Any initiative that you have going on will be affected in either a positive or negative way. Also, just a word about complex adaptive systems. If you think about how different we are from machines, and without going into a whole lot of a spiel about what complex adaptive systems are, I think you probably have a general idea about the relationships between the parts of a complex adaptive system are really important. And that relationship will manifest in these people skills. And so they really do have a rippling effect on all of our systems. I think sometimes they're elusive and they're hard to measure, and that's maybe to some extent why we haven't been doing a really great job at addressing them. In our medical model, we're more used to focusing on the evidence-based stuff, and that's important. And in fact, let's look at some evidence-based information that pertains to patient safety. And what we're going to talk about for the next few slides are people skills and sentinel events. And sentinel events are those unexpected occurrences that are catastrophic. They're not always reflective of medical errors, but they often are. And if you look at the categories such as retention of a foreign object or delay in treatment, which, by the way, is, I think, the most frequent type of event and may be more pertinent to the types of practices that you guys are leaders of. Anyway, the root causes of those sentinel events are tracked by the Joint Commission, and you can find there's a link to the specific site at the end of the slideshow, which might be another reason to come back to the website for NAIMP. But you can also find it by just Googling the Joint Commission sentinel events and poking around, and you'll find it. And I'm taking the statistics from the root causes, and they break them down into 17 categories, and each of those categories has some subcategories. And those are the ones that are causing our biggest problems. And so for the most recent data, I'll take you from 2011 to the second quarter of 2014, shows that the leading root causes of all sentinel events are human factors and leadership and communication. And those really aren't different than they have been for the last 10 years. I've been following those statistics for about 10 years because that's about as long as I've been teaching communication and collaboration, although I've been a nurse for about 30, almost. But so which is in the first place and which is in the second and third place may move around a little bit, but those three areas are consistently leading the way in terms of our underlying problems. And so the next three slides I'm going to show you are the details, just copied and pasted from the Joint Commission website about the subcategories of each of those categories. And I'm going to ask that as I show you the slides and as you're listening to me highlight some of the subcategories in the audio, if you try to keep in mind a sense of wondering about what people skills might be going on. Are these people getting along together? Do they respect themselves and each other? Are they listening? Are they speaking up? Are they asking for help? Giving and receiving feedback. So keep those things in mind for the next three slides, if you would. The first one is human factors. So these subcategories include things like staffing levels and staffing orientation, in-service education, competency assessment, staff and resident supervision, medical staff peer review, rushing, fatigue, distraction. You start to imagine that if I'm aware of how stressed I am, then I can work to set limits that's related to that true limitation that I have about how much overwhelm I can manage, and I can ask for help. If I'm too tired to work safely and I respect how I feel and I have a sense of safety that the people that I'm working with are going to respect that, I can say, I'm too tired to work safely. And those are really key elements of working in a team and providing care safely. Another example would be to look at the staffing levels. And if you can imagine, I mean, nurse staffing has been an issue since I've been a nurse, almost 3 decades. And it's really hard to pinpoint an exact recipe that will work. And I think that's partly because an exact recipe won't work. It might work on Monday, but it won't work on Tuesday. Or it might work with these 3 nurses, but it won't work with those 3 nurses. And that's in part because of the relationship dynamics that are going on. So let's look at the next category and subcategory, and that would be leadership. And again, we see some things like organizational planning and culture and community relations, all of which involve how we are in our workplaces, what we bring to the table, and how we are interacting with others. Leadership collaboration and integration of services, performance improvement, noncompliance with policies. Probably that's a great example for how resistance or might manifest. It might not be resistance. It might be that there's all sorts of systems issues going on, but there might be some people skills going on in that. Medical staff organization and nursing leadership. And so then let's go to another slide where the subcategories of communication, they're maybe a little bit more obvious because basically the subcategories include all of our oral, written, electronic communication with everybody, with each other, with patients, with families, with administration, among physicians, probably among nurses too. So I hopefully that gives you an idea of this evidence-based problem that we have a people skills issue in healthcare, and it's causing problems in patient safety. And so now, the good news, I think, and get very excited about, is enter this concept of medical improv. And medical improv, as a definition, I could tell you that it's taking activities from theater improvisation and using them to build people skills that we need in healthcare. And there are some different definitions you'll find, again, in the resources that are on the slides. That there are some peer-reviewed articles that will help, that there may offer a little bit more sophisticated definition, but that's basically what it is. And you'll also find that medical improv is a kind of what we call applied improv. And some of my colleagues might argue that, well, we should just call it applied improv. Why are we calling it medical improv? And I call it medical improv because the application is so specific, and there's so much rich learning that can take place in the debriefing, in the framing of the activities and the debriefing of the activities that are really should focus on the medical issues that we have, whether it's safety or workplace violence or whatever it is that we're going to talk about. So it builds important skills, including critical thinking and teamwork. It decreases stress. It can be so much fun once you get the hang of it. It's a lot of people are a little intimidated at first, but if we can move past that a little bit and take the risk to try it out, it's so much fun. And once you learn these principles, you can play. There's hundreds of games. You'll find all sorts of them. There's a million books out there, and you can Google improv or applied improv, and you'll find all sorts of resources. And I also blog quite a bit about it at Confident Voices. So what are the principles that you have to learn in order to play these games, and why are they helpful in healthcare? And the first one is called, this is the golden rule of improv, and it is called to say yes and. You have to say yes and basically what that refers to is whatever activity you're playing with, when somebody contributes something to the activity, you take that as an offer, or some people call it as a gift, and you build on it. You don't block it or say something totally different. And it really requires that you listen and you speak up. You cannot practice any improv activity without doing both of those things. And part of the magic is, for those of us that are stretching edge in terms of these people skills, for me it's assertiveness, is developing assertiveness. So I will be learning assertiveness in the same moment that somebody else might be learning how to listen a little bit more respectfully. So there's magic in that moment because both people are learning different things, but they're learning what they need to do to grow in their own emotional maturity. The second thing is to surrender your plan and co-create, and that's sort of related to yes and, except there's this more of an emphasis on listening, I would say, and to realize that you will have ideas about where a conversation where you want it to go, but when somebody else brings something to the table, there is a shift in where it's going, and to be able to be flexible around that is a great skill to develop in terms of change management. And to just give you an example, there's a game called Dr. Know-It-All, or you can call it Mr. Know-It-All or Nurse Know-It-All or whatever you want, Know-It-All. And so there are three people that sit side by side, and they need to answer open-ended questions from other participants. I use the term participants rather than audience to help take the focus off of the production and put the focus on the process. Anyway, so asking open-ended questions like how do you make chocolate chip cookies? And the three people that are sitting next to each other have to answer that question. They don't have to be factual. They can make up any kind of lie that they want, but it has to flow. So they might answer one person at a time. You make chocolate chip cookies by stirring, somebody might say stirring up, and the third person has to say stirring up something. They can't say chocolate. They might have been thinking buy chocolate chips. So they have to kind of relax and go with the flow. So imagine a situation, there was a physician, a surgeon, who was sitting in the middle of the three people, and he was sitting on the side of two nurses. And there was this moment, I can't remember what the question, it might have been, why is the sky blue or something, but there was this moment when I could see the nurse was hesitating to say something, that she said something, and I could tell that it was different from what the surgeon was expecting, and he had to, just for a moment, change direction. And so it was this opportunity for the nurse to be in this little bit more challenging, comfort-wise zone of speaking up, while the surgeon was in this little more challenging place of listening and going with something different. So it allows us to learn how to be leaders and learn how to be followers. And in healthcare, I think that we all need to be able to do both. Physicians are going to be in leadership roles with respect to clinical situations most of the time, but they also need to be able to take in new information and change course if somebody sees something that's going down a path that might be a problem. And so the ability to be able, that's what collaborative leadership is all about, is to be able to dance between this hierarchy of being in charge and also to be able to be flexible and listen. And the opposite is true, I think, for nurses or other support staff who may be more in following positions or 50-50, following some people and leading others, to be able to vacillate between that being in charge place to being flexible to taking an input. The next one is avoiding questions, and that's kind of an interesting one. You might think that, well, we don't want to teach people not to ask questions. We want them to ask questions, and that's true. In healthcare, we do want people to ask questions, but we also want people to bring to the table what they know. And I think the best way to illustrate that is to give you an example from my nursing career, where, and I'm sure physicians might be able to resonate with this, that they've heard staff, whether at any level, come up and say, did you want to order an x-ray for Mr. Smith? And that, instead of asking that question, if I say, I think ordering a chest x-ray for Mr. Smith would be a good idea, what do you think? Well, that's asking a question. But if I just say, I think ordering a chest x-ray for Mr. Smith would be a good idea, then that, I'm being more assertive in that. Instead of asking a question and dumping it on you or the other person, I'm taking charge of what I know. And that gives me a chance to be confident, to be assertive, and it also opens up an opportunity for the physician or nurse practitioner to say, well, yeah, that is a good idea. Yeah, let's order it. Or to be a teacher and say, you know what, it's a good idea, but I'm not going to order it for ABC reason. And so then you get to have an exchange of information. And that's much more powerful, I think, than me pretending I don't know and pretending that, and you pretending that I don't know. Or maybe you think I don't know because that's what I've told you. It's sort of like I give my power away in an unhealthy way. So in improv, you can't do that. And I was even, when Shirley and I, Shirley will do some demonstrations with us in a little bit, not quite yet, but I catch myself asking questions when I already know something, and that's such a powerful learning edge for me. Listen and be present. I think that's probably more obvious, and you can't really be multitasking. There's probably some really high-functioning, brilliant brains out there that can, but people that are watching and people that are practicing with you will be able to tell that you're not with them in the moment. So this principle sort of forces you to learn to just be here and to let go of everything else. And we can't do that maybe in our clinical worlds much of the time, but boy, what a relief it can be to just be in the moment with somebody else for this activity. So it's a great opportunity to just sort of relax and be together. We also do a thing called a failure bow in improv, and that's about being human about mistakes. And again, we don't want to say like we're promoting mistakes in healthcare. That's not the intended meaning of this. But what it does do that's very powerful, I think, is it helps us to be more human together. And if you make a mistake in improv, it's like if you say something that doesn't fit, everybody just says, oh, you made a mistake, or oh well, and you get a little applause and you bow and you move on. And so it allows us to be together and be imperfect, which really is important in terms of just being in authentic relationships and counting on each other. But it's also important from an organizational cultural standpoint. If you think about the issues that we have in our blaming cultures or our bullying cultures, where there's a tendency to push things off on other people, and this helps us to bring it back and to have some ownership on what's going on in a safe way. The next one is about remembering that you have everything that you need, and that's like if there are some sports enthusiasts among you, you think about playing a basketball game, and if you're practicing, it's one thing. You can stop and start, and you can learn or practice another skill, trying to get better at shooting foul shots or whatever. But in the moment, you have to rely on the skills that you bring to the table. And so so whatever's going on in the clinical moment, this is like a critical thinking opportunity, that instead of being anxious about what we don't know, or maybe somebody's going to judge us if we make a mistake, or we're going to hesitate because we're not getting along with a particular person, this principle helps us to not go there, but to trust that we have what we need to make things happen. And in an improv activity, you do. That you really can't, whatever direction that you go in, that's going to be okay, because of the last principle, that, the people that are in the game with you, or the person that's in the game with you, is going to support you. In fact, I just shared that with Shirley, because I forgot to tell her that in our initial conversations, that whatever you are going to say, I'm going to work hard to support you. And isn't that a wonderful message to get in terms of helping each other in the workplace? So those are the principles. You might find variation. If you look online, you might find 8 principles or 6 principles, but those are the basic ones. And once you learn them, you'll find that there's so many games and activities out there, and they're often categorized in different ways. And these are just some of the common ones, but you're likely to see some different ones. But you could say, well, geez, what people skill do we want to work on this week or this month or this year in our practice? We want to work on trust and creativity. So then you can come up with a bunch of games or activities, and you can play those activities with the idea that you're going to build your trust and your creativity. And then you can have the debriefing. Shirley's going to help again in a couple minutes, not quite yet, but I want to say a little bit about the debriefing. That's where we can have fun playing these games, but then we can bring it back to some of the serious nature of why communication skills and people skills are so important in healthcare, and where is it that each of us has our own learning edge, and we can privately think, what can I do to develop that learning age. And honestly, I've been teaching communication and collaboration for a decade now, and what's missing is more about behavior and emotional intelligence. It's not the intellectual knowledge about what communication is, what listening is, and what speaking up is. So these are just some of the categories. So I guess that it's getting time for Shirley and I to do some demonstration for you, so that you can actually get more of a sense of what it is like. And there's a couple of activities that she's agreed to do with me on today's podcast. The first one is called Yes and, Yes But, and No. And this activity involves partners and 3 different conversations. so that each conversation is a little bit different. And it's particularly useful in teaching the principles that I just discussed. And then in the debriefing, we can talk about the quality of the conversations and the comfort level. And so, Shirley, are you there?
I am. I'm ready. I'm unmuted.
Oh, okay, awesome. So the first conversation we're going to talk about pets. And in this conversation, the idea is that each of us says yes and to what the other person says, so that we're validating that person and we're bringing something more, excuse me, to the table. So shall I start, or would you like to start?
You're welcome to start.
Okay. I just got a new little golden retriever puppy, Shirley. I'm so excited.
Oh, how wonderful. Yes, I've heard the benefits of having puppies is just wonderful for emotions and exercise and a lot of great things.
I'm so looking forward to all of those things that you mentioned. I think I'm going to feel happier, and I'm really excited to get out and go for a walk. And I was thinking of going for a walk down in the center of town with my new puppy today.
Yes, that sounds like a great idea, and I would love to join you on the walk.
I'd love to have you come with me on the walk. I'd love to have you meet my little puppy. And you have a puppy too, don't you?
Yes, I do have a puppy, and it loves to interact with other dogs, and I'm sure it would love playing with your new puppy.
That would be great. We can go for a nice long walk and catch up, and our puppies can get to socialize.
Yes, and it'll be a great day. I'll really enjoy seeing you again.
Thank you, Shirley. So that gives you an example. And you notice I did ask a question, which if I were coaching, I would have zapped myself for asking that question about Shirley's puppy. But anyway, Shirley, you did a great job. And I just might ask, how was that for you? What thoughts went through your mind, or what feelings did it evoke?
Well, I do appreciate the question queued to help me with the information. But when we talk, the yes and, it makes me feel encouraged and positive, and it makes me feel like I want to continue the conversation with you, that I'm accepted, and that you want my input.
Well, that's just wonderful. I think those are wisdoms that speak for themselves. Let's try doing another conversation that will, instead of saying yes and, we'll use yes but to interact. So would you like to start this one on weather?
Sure.
Okay.
Well, I'm here in North Carolina, and we're expecting snow tonight.
Well, yes, but snow really isn't a big deal from where I come from. We get it all the time.
Yes, but in North Carolina, we hardly ever get snow, and 1 or 2 inches will shut down the city, and we're expecting 4 to 8 tonight.
Oh, yes, but 4 to 8 really is like nothing compared, we get 2 feet all the time. It's not a big deal. I don't know what you're worried about.
Yes, but in North Carolina, the streets will close, the grocery stores will run out of milk and bread and eggs, whether we need it or not. But we're going to be stranded for days just based on a few inches.
So, how did that conversation feel? Are you ready to punch me?
It's discouraging. It feels like it's a battle or a competition, or that you really don't want to continue the conversation. It's a little discouraging with the yes but.
Yeah, I could hear it in your voice, and I could feel it for myself too. And I know most of you probably have heard of the different kinds of listening, attentive, or combative or competitive. It is more competitive, that I want to say what I want to say. It's not about listening to you. So, well, as you do this, you'll find that you might have a tendency to do one of these more than the other. So one more category that we'll use no. And what did we have a decision about what that was going to be?
I don't remember. You pick a topic.
Okay, let's talk about traveling.
Okay, super.
And since I picked the topic, you decide whether you'd like to start or you'd like to have me start.
Well, I'll start. With all the cold weather coming, I thought I would plan a trip south.
Oh, don't do that. The prices are so high right now, and you don't even have any guarantee you'd get there.
And I'm just stuck because I don't know if I responded no again. I do want to comment on this one that I noticed a couple of days ago, interacting with some friends, that the no and the yes but shut down some conversations really fast, unintentionally, and how we don't mean to, but how it does create a negative feeling in the room.
Wow, that's a really powerful observation. That's exactly the kind of stuff that we learn. I mean, we might learn different things. I've learned so much about how I tend to hesitate or ask questions. I've been teaching this stuff for years, and I still do it. You know, so it's okay. I'm smiling about it, but it's just sort of an acknowledgement about what I can learn from this work and how I can do a better job of communicating, bringing my expertise to the table, and learning from other people. So it's really powerful stuff. It sounds like it's just fun and games, but it's much more, isn't it?
Absolutely. It really makes a difference.
Now we're going to do another example or another activity, and this one is a little bit more challenging. I usually don't teach it until we've had a little more practice with the principles, but Shirley and I have talked about it, and she's ready to try it out with me. It's called one-upmanship. You can do it. You can also do a one-downmanship if you want, but we're going to do one-upmanship. And I'll give you a little bit more debriefing about why it's so important. It's one of the many status games. And so are you ready,
Yes, I'm ready.
Shirley? Okay. And we're going to talk about food, right?
Yes, recipes, I believe, is what we picked.
Okay, yes, recipes. And would you like to start, or would you like me to start?
You start.
Okay. Oh, I'm really excited to try out a new recipe with some new kind of artichoke pasta that I bought. So I'm pretty excited to try that out for dinner tonight.
Oh, that sounds great, but I made a chicken dish last week that was amazing, and everyone that came over for dinner that night loved it.
Wow, that sounds really good. That sounds like almost as good as when I opened up my restaurant down the street and I started cooking some new baked goods, and people were coming in from all over the town to try them out.
Oh, well, congratulations on your restaurant. You know, I've created some great baking recipes and have written a book, and maybe you might want to go to the bookstore and buy my book to get some recipe ideas.
Wow, that's wonderful. Congratulations on your book about cooking. I bet that's a really a bestseller almost. It reminds me of the series of books that I wrote with some of my famous recipes that's going to be turned into a movie. Did I mention that?
Oh no, maybe you could be a guest speaker on my daily television show, and we could do a brief little interview on your upcoming movie.
That was great, Shirley. I love how you snuck in that little brief. We could do a brief interview, because in that moment you're like taking more status, aren't you?
But it was fun. Now that you told me I could fib a little.
Yeah, you can fib all you want. That's part of the fun. So, what feedback do you have, Shirley, about that experience?
Well, it might be fun, but I don't think we accomplished anything. It doesn't build the other person up, and honestly, it really doesn't build me up either. It just gets this kind of an antsy, competitive feeling going. I don't know that it accomplishes anything.
Okay, yeah, it is. It's kind of silly but obnoxious at the same time.
Mm-hmm.
What it can do in debriefing, as well as some other status games, is we can start to talk about what's the difference between high status and low status, and what does it look like, and what does it feel like. Which one are you more comfortable in? Which one might be a place where you might want to grow? That word that that about the just short, brief interview was a way of just sort of cutting me down. And so as we become aware of those things, we can start to use them in our practice in some interesting ways. And I'll give you a couple of examples. There's a physician that I took a training with who shared that after he had practiced some status games, he intentionally created a lower status profile in an interview with a young woman who had just been raped. And he did that very intentionally to help make her feel comfortable. So he used his body posture and a quieter voice, which if you assume a smaller body posture and a quieter voice, typically those are examples of lower status. But he did that just to make her feel more comfortable. And I've used it in my experience as a presenter to, like, how fast I talk. If I'm nervous, I tend to talk more quickly, ask more questions, apologize, fidget more. If you become aware of the things that are typically more lower status, you can work to create a more balanced presence, centered presence for yourself, or that's what I do anyway. So those are a couple of examples. And I think if you stretch a little bit and use your imagination, you can look at where do we need status between doctors and nurses nurses assistants and patients and doctors and all those where there are power dynamics, and where are they healthy and where maybe are they more ego-based, and what can we do about those. And I think actually those are pretty important conversations and personal awareness to have. So that's some stuff about medical improv. I'm really happy that you were listening in, and I hope that it's been informative for you. I think there's all sorts of possibilities. I'm kind of a big vision person, and I see ideas for having undergraduate courses where anybody that's studying any kind of healthcare program, social workers, pre-med, nursing, dentistry, holistic health, anything. If we're all together in a room learning some of these principles and playing these activities, then we will create relationships that will transcend our whole careers. So I want to see them in undergraduate school. I want to see hospitals piloting projects where they have it in orientation, they have everybody learns the principles, and then there's monthly sessions or whatever. You can do standalone workshops just for the principles. You can have series. I think there are possibilities where organizations that are excited by this stuff will have fundraising opportunities, or get to know with a patient's night, or little fun performances if you want. So I think there's lots of room to launch your own. As far as resources go, I've got a bunch listed on the next slide that will be at NAIMP website. And I think there's probably resources around you. You may have some staff that already are interested and do improv, or may know somebody that does. I'm very happy to be a resource indirectly or directly. If I can be helpful in building this stuff, I'm all for it. Let's see, there's also some healthcare and improv specialists in different parts of the country. In some ways it's new, but in some ways improv has been going on forever. But you'll see in the resources several nurse colleagues that are in different parts of the country that do medical improv workshops. We all call it something a little bit different. And there's also a YouTube that's a long one. It's an hour and a half roughly, where it's myself and a couple of colleagues and then a bunch of experts. There's a half a dozen experts from all over the country. We did a Google Hangout, and in that video I go into a little bit more detail. We go into a little bit more detail about how people skills impact patient experience and worker safety, as well as the Sentinel event stuff that I talked about today. So anyway, I hope that it's helpful and exciting, and I wish you all the best. And here is my content. Here are the resources. I'll skip by them, assuming that you wouldn't read them anyway right now, but they're there forever in cyberspace. And thank you so much for attending, and contact me if I can be helpful.
Beth, thank you very much for the great information. And I know we prepared a little last week, and I've seen the benefits of medical improv just in working with colleagues and also with friends now that I'm more aware of it. So I definitely encourage our listeners to pursue learning more about that. Going to the NAIMP.org website to look at the slides and especially look up the resources. And if you want to contact Beth at bethboynton.com, that's BOYNTON.com, or her website confidentvoices.com, and her number is 603-319-8293. So Beth, thank you very much. We really appreciate the expertise and knowledge that you've shared with us today.
Oh, thank you, Shirley, and everybody listening.
Yes, and for our listeners, then we'll talk to you again soon. Thank you.